Everyone in the audience, just tune this out. The cookies that are on your desk panel are courtesy of Francie, so let's give her a little hand. Now, you in the audience did not hear that. There are no cookies. These are not the cookies you're looking for. Okay, we'll call this meeting to order. Today, we're starting our hearing on the Kansas Department of Aging and Disability Services. And to begin with, then we'll have Dayton LeMunyon give us the budget analysis. Dayton?
Thank you, Chair Mason, members of the committee. My name is Dayton LeMunyon, Fiscal Analyst for Legislative Research, and I'll be presenting the KDAD's budget today. I guess that's where the mic's going to be. You should have two documents in front of you. One are a set of pie charts that I'll reference, and the other is the budget analysis that you're familiar with. So the Kansas Department for Aging and Disability Services oversees the state hospitals that you heard previously, the aging services, disability services, mental health and behavioral health services for the state, including the Medicaid expenditures associated with such programs. For the budget, I'd like to begin on page 5. On page 5, you'll see a table summarizing the budget by category of expenditure. There are two items I'd like to draw your attention to here. The first is the other assistance line. That's $2.4 billion in fiscal year 23. That is the largest part of the KDAD's budget, and it's primarily Medicaid expenditures. So if you'll reference the pie charts I've given to you, the large blue part are Medicaid expenditures. The next largest are behavioral health grants that are outside of Medicaid. Then aging and disability programs, and the smallest part are other expenditures that you see broken down. If you turn to the next page, you'll see more detail for the Medicaid programs. The two largest are the HCBS waivers and nursing facility payment expenditures. Next are mental health services, including CCBHCs that are funded through Medicaid, PRTFs, 10% FMAP projects, PACE. The green and orange are again the same as the prior pie. So I thought that might be helpful in giving you all some understanding of what makes up this budget. I know it's a lot to get into. The next item on this page I'd like to draw your attention to is the State General Fund line under financing. You'll note there's a large change between 23 and 24. I'll just note that for now, and I'll reference that again later on page 5 of the budget analysis.
We're still on page 5, right?
Yes, that's correct.
Okay, so
I was referencing the State General Fund line. You'll see $914 million in 23 and $1.4 billion in 24.
First line under financing on page 5. Representative, okay.
Just flagging that for now. I'll give more discussion to that in a few moments. Now I'd like to turn to page 7, which begins the fiscal year 24 analysis. Subsequent to the 2023 session, 3 adjustments were made to the $3 billion, including $1.2 billion SGF that was appropriated to KDADS for 24. These adjustments changed the approved amount without any legislative action required, and they include item 1. The agency reappropriated $123.3 million state general fund in savings in the HCBS waiver programs. These were due to changes in the federal medical assistance percentage following the submission of the budget. Unlike other Medicaid expenditures that are included in caseloads, which caseloads are reestimated in the spring and fall, the waiver funding is not reestimated. It's based on the agency's budget submission in September. So the extension of the public health emergency resulted in SGF savings there. And later on in the budget analysis on page 31, there are more details on how the agency will spend those reappropriations. Next, moving to item 2, the agency reappropriated $41.6 million SGF in savings. These are related to 10% HCBS FMAP projects. During the public health emergency, the agency received a 10% bump to their HCBS funding. However, the savings resulting from that, the agency was required to use to further develop those programs. So those programs are ongoing. Again, more detail on page 31. And then finally, Item 3, the agency reappropriated 33.8 million SGF. The largest of these is the hospital in Sedgwick County that is currently in development. Turning to page 8. For the agency estimate, the agency estimates revised expenditures of $3.3 billion, including $1.4 billion SGF in '24. This is an increase of $111.7 million, including a decrease of $23 million SGF from the amount approved by the '23 legislature. This revised estimate includes a decrease of $7.4 million SGF due to 2 enhancement requests. The first one is a lapse of the caseloads reappropriations. The agency requested to lapse this since those funds are reevaluated in the fall. Item 5 is the pay plan shortfall that you all are familiar with from other budgets, and that total is $85,000. Absent the supplemental request, the revised estimate includes an increase of $119.1 million, including a decrease of $15.6 million SGF. Significant adjustments include an SIBF reappropriation of $15.5 million. Those are for projects at the state hospitals. Item 7 are Spark grants. $66 million was awarded to KDADS from the State Finance Council in federal ARPA funds. The agency was directed to distribute these funds to grantees, and a number of those projects are listed there. Item 8, the agency's revised estimate includes an additional $34.6 million in federal grants. These were not budgeted for last year, but the agency has revised their estimate in the current year. Finally, item 9, the agency's revised estimate includes $12.3 million SGF due to the transfer to the hospitals in '24. Moving on to page 9. Item 10, the agency's revised estimate includes an increase of $9.7 million, all from special revenue funds for community crisis stabilization centers. The proceeds, or these, the crisis stabilization center funding is funded through lottery vending revenue. So the primary reason for this increase is $8.9 million in unspent funds in the prior year that have reappropriated. The agency reports that's due to slower expansion than anticipated. And item 11 includes $5 million for county competency reimbursements to enact SB 228. Now moving on to the governor's recommendation. The governor recommends expenditures totaling $3.3 billion, including $1.4 billion SGF in '24. This is a decrease of $32.8 million, including $12.1 million SGF below the revised estimate. Item 13, the governor does not recommend adoption of the request to lapse its consensus caseloads appropriation, and this is related to item 14. The governor recommends the deletion of $39 million, including $18.7 million SGF, to adopt the consensus caseloads revised estimate. The primary reason for this decrease is a revision to CCBHC funding. It's a decrease of 11.6, including $4.5 million SGF. This is to account for several of the CMHCs transitioning partway through the year. Item 15, the governor recommends lapsing $903,000 SGF from the CARE Passer program. This program has been included in caseloads due to it being a required program. So this deletion is to avoid double counting. And I'm happy to stand for questions on 24.
Committee, what questions do we have for Dayton for fiscal year '24? Representative Barth.
Okay, thank you, Mr. Chair. Looking at number 11 there on page 9, you said the county competency reimbursements, and you mentioned the statute SB 228 for last year. Can you remind us what that is?
Yes, so SB 228, part of what it does, the part that's pertinent to this, is that it requires reimbursement for jails for the observation and holding of individuals who are awaiting competency evaluation or treatment. So during the Larned State Hospital presentation, you heard about a wait list with forensic evaluation and competency. So that's resulted in individuals being housed. The bill provided reimbursement to those the jails.
Perfect. I do recall that. Actually, we talked about it in Miami County last weekend, so they appreciate this.
Representative Carpenter.
And so, Andy, is that in the budget this year? Is that in the governor's budget in 2025?
Mr. Chair, Representative, yes, this continues in 25, yeah.
Representative Clifford.
Thank you, Mr. Chairman. Where might we see which counties got what monies? Is that publicly available yet?
I do have a tracking for that. I don't have it with me, but I can print it off and bring it to you all tomorrow.
Thank you. Thank you, Mr. Chairman.
Further questions on 24? Committee? Seeing none. Dayton, thank you.
Thank you. If you now turn to page 11. Previously, I flagged that increase from 23 to 24 in the state general fund financing. I think this is a good way to explain that. So looking at the chart, the legislature last year for fiscal year 2023 approved $2.8 billion. However, the agency only spent $2.6 million of that total approved amount. That resulted in 171.3 unspent state general fund that carried over into the approved amount for fiscal year 2024. You'll recall that I just a few minutes ago referenced that in item 1 through 3 in the fiscal year 24 budget. So the effect of that is that it's really it looks like a double counting because there's a decrease in 23, but also an increase due to the reappropriation. So that $400 million gap is really due to that reappropriation, and things will level out in future years. And I'm happy to stand for questions on that.
Committee, are there questions? Seeing none. Thank you.
Thank you. I'd now like to move to page 12. Items 1 through 4 on page 12 are the agency's enhancement requests. There are 20 of them totaling $122.5 million, including $50 million state general fund. These result in an agency request totaling $3.1 billion, including $1.3 billion SGF for 25. Before I get into the enhancement request, I'd actually like to walk through items 5 through 8, and then we'll turn to the enhancement requests. So item 5 is backing out those reappropriations. Those will all be spent in fiscal year 2024. So this explains part of that decrease from 24 to 25. The same is true for item 6. Those Spark grants will go out in fiscal year 24. And item 7 is an item that was approved by you all last year, by the legislature last year, $22 million for Ascension via Christie, and that went out this year. And then those decreases are offset by item 8, which is the 24/7 pay plan transfer to the state hospitals. If you stand for questions on those before the enhancements.
Any questions? Representative Ballard.
Thank you. So if I'm looking at 5, 6, 7, and 8, so 6 would be the non-reoccurring Spark grant. Okay, does that goes through 25, or does it go through 26?
Mr. Chair, Representative, it only occurred in 24. So you see in 24, there was $66 million. There was an increase. You see a decrease here because it was one-time funding. So if you look at the number at the top, the request without major changes, which is $1.4 billion state general fund, that number should be similar to the 2024 amount. So items 5, 6, 7, and 8 are just accounting for shifts in that amount. I hope that's helpful.
Yes, that is.
And since they were in fiscal year 24, but they're not in 25, then that takes it out of the base.
That's exactly right.
Okay.
Got it.
Any other questions, committee?
Thank you, Mr. Chair.
Proceed, Dayton.
Okay, items 1 through 4 and 9 through 14 mostly do with enhancement requests, so I'd like to turn to page 19, which I think is an easier way to view them. On page 19, what you see is a table containing all of the agency's enhanced supplemental and enhancement requests. The first set of numbers are the agency requests contrasted with the governor's recommendation. So for example, in item 1, you see a decrease. That was the lapse of caseloads reappropriation. The agency requested a decrease. The governor did not recommend, so you see a 0. So if you go to the bottom of the page, the fiscal year 25 total, you can contrast the total request by the governor versus the total requested by the agency, contrasted with the total recommendation by the governor. And now we can begin looking at the enhancements by program. So if you turn to page 20, or if you'd prefer to stay on this page, either way. But I'll be walking through the text on the following page. Or, sorry, page 21. I already walked through page 20. Those are the supplemental enhancements. So page 21, item 1, the first enhancement request for fiscal year 25 is for community support waiver staffing. The agency requests $358,000, including $180,000 state general fund and 2 FTE positions. This would be used to employ an IDD assistant director and a community support waiver program manager. Additionally, it would continue funding 2 existing quality assurance specialist positions. These are funded using those HCBS 10% FMAP funds currently. The governor recommends adding the funding for these, but not the FTE positions. Item 2, program for the all-inclusive care of the elderly, PACE staffing. The agency requested $175,000, including $87,000 state general fund. This would continue funding 2 existing positions that are again funded with those HCBS FMAP funds. The governor does not recommend adoption of the request. Item 3, technology assisted or TA waiver program manager. The agency requests $88,000, including $43,000 SGF and 1 FTE position to employ a TA waiver program manager. Currently, the TA and SED waiver are both overseen by the same individual. The governor recommends adding the funding, but not the position. And I'd stand for questions on those.
Committee, questions? Seeing none.
Thank you. We'll move on. Well, I note at the bottom of the page is the table for the Behavioral Health Commission enhancements. And if you turn to page 22, you'll see the text describing those. Item 1, sustaining Behavioral Health Commission staffing. The agency requests $570,000, including $285,000 SGF, to sustain 7 existing FTE positions that are currently funded with a federal CCBHC planning grant. The governor does not recommend adoption of this request. Item 2, the agency requests $88,000 and 1 FTE position to employ an employment and benefits coordinator. They would provide training, technical assistance, and outreach to KDADs and other state agencies to support employment first. The governor recommends partial adoption of this request, and the adjustment here is to add FMAP funding that would match the state general fund. Item 3, family support coordinator. The agency requests $88,000 SGF and 1 FTE position. This position would serve as the lead family coordinator for federal SAMHSA and HRSA programs, assisting with several of the agency's behavioral health programs. The governor recommends partial adoption, again utilizing those FMAP funds. Moving on to item 4. The agency requests $3 million SGF. This would fund actual treatment costs for individuals participating in family treatment courts, which are planned to serve SYNC children. The governor recommends partial adoption of $1.5 million. Item 5. The agency requests $88,000 SGF and 1 FTE position to employ an infant and early childhood mental health coordinator who would partner with children and their families to provide early intervention to prevent behavioral health issues later in life. And if you'll turn the page, the governor does not recommend adoption of this request. Item 6, the agency requests $1.5 million to sustain case management funding for the NFMH pre-litigation settlement agreement. This would address requirement number 6 of that agreement. The case managers are available to develop person-centered plans, including a plan to transition to the community upon admission to those facilities. Currently, this is funded with federal COVID funding, and the governor does not recommend adoption of this request. Finally, item 7, the agency requests $5.1 million SGF and 1 FTE position. $5 million of this funding would be used to increase the number of substance use disorder services available, the number served, and the rates paid to those providers. Additionally, the remainder would be used to fund a coordinator for the programs. And the governor does not recommend adoption. And I'll now stand for questions on those.
Very well. Committee questions so far? Representative Ruiz.
Looking on page 23, number 6, the NFMH case management. I see that the governor didn't recommend adoption of this. Isn't this required? Isn't it a part of the settlement agreement?
Mr. Chair, Representative, as referenced in the text, number 6 does require that those services are provided. I'm sure the agency could give more detail as to whether there's an alternative funding source or more what they would do if they don't receive the funding.
Thank you.
Committee, other questions? Please proceed.
Moving on to page 24. These are the Medicaid program enhancements. Item 1 is to add the assistive technology service for the comprehensive IDD waiver. The agency requests $7.8 million, including $3 million state general fund, to add this service to the comprehensive IDD waiver. This was a recommended service for the proposed community support waiver, and the governor does not recommend adoption of this request. Item 2 is the cognitive support service for the physical disability or PD waiver. The agency requested $9.5 million, including $3.7 million state general fund, to add this service to the waiver. It would be utilized for individuals who are transitioning to the PD waiver from the BI waiver, and it would have the goal of facilitating cognitive rehabilitation to prevent a wait list and provide seamless transition to the PD waiver. The governor does not recommend adoption of this request. Items 3 and items 4 are requests by the agency to add 500 additional IDD waiver slots. The governor initially did not recommend this request, so that's why you see zeros in the table above. However, in her governor's budget amendment number 1, she did recommend funding half of those, so 250 for each of those. That would be an addition for the IDD waiver number 3 of approximately 6.7 million SGF. And for the PD waiver, it would be an addition of 2.2 million state general fund. And turning to page 25.
Yes, Representative Ballard.
You said for 250. What was the dollar amount, please?
The dollar amount for item 3, the IDD waiver, was 6.7 million state general fund.
Proceed.
On 25 again, item 5, specialized medical care T1000 rate increase. The agency requests $9.1 million, including $3.5 million state general fund, to increase that rate for the TA and IDD waiver. This would increase the rate from $47 to $55 per hour. The governor does not recommend adoption of this request. And the final request for the Medicaid program is supported employment rate increase and unbundling. The agency requests $29.9 million, including $11.5 million state general fund, to increase that rate from $18 to $53 per hour. The governor recommends partial adoption, increasing that to $28 per hour. And I'll now stand for questions on the Medicaid program enhancements.
Okay. Committee, questions on those? Quick one, Dayton. On the governor's budget amendment, how will that show up in future documents? Will that be incorporated as we proceed here?
So, Mr. Chair, the next step for that would be adoption by House Appropriations, and that would appear then in the subcommittee report for House Appropriations Committee action.
Okay, very well. Committee, other questions? Seeing none.
Thank you. Then if you'll turn to page 26. These are enhancements for the capital improvement program. Again, these are capital improvements that KDOT's receives this funding on behalf of the state hospital, and they are all funded from the State Institutions Building Fund, or SIBF. For item 1, the agency requests $5.6 million, again, all from the SIBF, to fund the priority 2 rehabilitation and repair projects that were identified in the capital improvement plan. These projects include replacing the medium voltage electrical system at OSH, $2.4 million, upgrading sewer mains at KNI, $770,000, replacement of deteriorated water mains at OSH, $700,000, replacement of a chiller at Larned, $700,000, and replacement of piping at Parsons, approximately $500,000. The governor does recommend adoption of this request. Moving to item 2. The agency requested $650,000 SIBF to raise a building on Larned State Hospital campus and on Parsons State Hospital campus. The governor recommends adding additional funding for a total of $3.2 million to complete all 9 raising projects in the agency's capital improvement plan, with a stated goal of maximizing cost saving by raising those all at once. Item 3. The agency requests $1.9 million to remodel the Cottonwood Recreation Building on Osh campus. The building includes patient recreation, a library, television rooms, and game areas, and the governor does not recommend adoption of this request. The final capital improvement request, item 4, for the special services and Myco House office renovation. The agency requests $873,000 SIBF to remodel these 2 buildings, both on Osh campus. This would allow utilization of the 3rd floor of the special services building and protect programs in the special services building, as well as expanding office space in the Myco facility. And the governor does not recommend this request. I'll now stand for questions on those.
Okay. Committee, do we have questions on those? Seeing none?
Thank you. I'll now turn to page 28, the final set of enhancements. These enhancements relate to items that the agency did not request necessarily, so these are governor's enhancements. Item 1 is the fall consensus caseload estimate. The governor recommends an increase of $30.3 million, including $15.8 million SGF to adopt to the initial estimate for 25. Item 2 is the care and passer lapse. Again, this is the same request as 24, and it is to avoid double counting as this was moved to caseloads. Item 3 is for housing solution grants. The governor recommends $40 million state general fund to provide grants to local governments. This is one-time funding and would be used to improve local infrastructure, and it would require dollar-for-dollar matching. Moving down to item 4, the governor recommends adding $120,000 state general fund and 1 FTE. This to create the state housing supports director position, who would facilitate and oversee housing programs throughout the state. And finally, item 5. The governor recommends adding $700,000 state general fund for a shoe and boot allowance for safety and security officers at the hospitals. And I now stand for questions on those.
Any questions? Seeing none.
Thank you. 2 more things that I would like to point out. On page 29, you will see a special topic section on the consensus caseloads estimate. Again, there are 2 enhancements, and 1 in 24, 1 in 25 related to this, so this provides more detail on how, what's driving those changes. And then on page 31, I referenced this in fiscal year 24. These are how the reappropriations would be spent. The remainder of the document is an overview of the agency by program, and I now stand for questions on the ks.gov budget.
Okay, committee, what questions do you have on the KDAD budget 24, 25? Representative Barth.
Thank you, Chairman Mason. Okay, so I do have a quick question, and it's a reference to this chart. And the KDAS expenditure by program, is that for FY 24, 25, or when is that for?
Mr. Chair, Representative, that's a great question. It doesn't fluctuate too much by year. I believe these were the fiscal year 2024 approved.
And then, do we have a page in the budget here that contains the dollar amounts that match up with the buckets here, the slices?
With the large buckets on page 32, you have, and that would be toward the back. You have expenditures by program, so administration, aging and disability, behavioral health, Medicaid, and on. So it's analogous, although there might be some crossover.
Okay, that's super helpful. Thank you.
Committee, other questions? Seeing none. Thank you, Dayton. All right, next I would call Secretary Howard. Welcome back.
Thank you, Madam Chair. Pleased to be back with you today. Didn't that sound genuine? It was, actually, you'll be in for a treat because I'm actually going to, for the first part of this presentation, ask my two deputy secretaries to talk with you a bit about some of our priorities and accomplishments in each of our commissions. And then I'll come back up to talk more directly about the actual budget enhancements. But this will give you a chance to hear some updates on some things you recommended last year and some agency priorities. So I'm going to start out first with Deputy Secretary Andy Brown, our Deputy Secretary for programs, and then I will then have Deputy Secretary Scott Bruner talk about a couple of the other commissions, and I'll come back up with your, very good. So Deputy Secretary Brown.
Hello, members of the committee. My name is Andy Brown. I'm the Deputy Secretary for Programs at KDADS, and I'm going to start on page 3, which is the Behavioral Health Services Commission. Our Behavioral Health Services Commission includes the mental health and substance use disorder programs. With mental health services, we contract with community agencies across the state to make sure that there are services for individuals and families that experience serious mental illness and co-occurring disorders. These programs are designed to be community-based and in the least restrictive environment. Similarly, for the substance use disorder services, we contract with community agencies to provide those services for treatment and prevention of addictions. Substance use disorder services ensure that there is a continuum of care available and accessible in every region of the state. Accomplishments that we wanted to highlight from the Behavioral Health Commission is that there's a certified 24 of the 26 community mental health centers as CCBHCs. So this was the process that we went by. We started with 9 the first year, and then 9 the second year, and then this year we've been able to add additional ones as the years progressed. So we only have 2 remaining CMHCs to certify before July 1st. We also were able to award 16 grants to CCBHCs for mobile crisis response infrastructure and creation. We expanded our problem gambling prevention and treatment education and awareness through marketing campaigns with additional appropriated funding. There was actually an example of that in the second floor rotunda earlier today. We were able to create and expand our assisted outpatient treatment programs through pilot sites with federal funding. And we were able to establish opportunities for grant funds for crisis stabilization for IDD individuals in Kansas. Our priorities moving forward in the Behavioral Health Services Commission, we want to focus on continuing to expand the provision of medication-assisted treatment, harm reduction, and contingency management among our SUD treatment programs. We want to work on addressing frontline workforce shortages to increase the capacity within the provider network. We want to invest in ways to create additional specialty court programs across the state, and we're making good progress on that. We want to continue to expand our OUD treatment and prevention to reduce overdose death rates. And we want to invest further in social determinants of health, especially housing and employment programs, and we're doing a lot of work on that with the current CanCare RFP. So I'll move on now to the Home and Community-Based Services Commission. The HCBS Commission leads efforts around the community-based services for those with disabilities. So this includes administering our HCBS 1915C Medicaid waiver programs, our ADRCs, and our administrative case management programs. The Commission works closely with its community-based partners, including the Community Development Disability Organizations, or CDDOs, our home health agencies, providers of physical disability and brain injury services, and specialized medical service providers. Our current waivers include 7 different HCBS waivers. The first is our autism, then there's frail and elderly, intellectual and developmental disabilities, physical disabilities, serious emotional disturbance, technology assisted, and then brain injury. For priorities and accomplishments, the HCBS Commission has been managing the 10% FMAP enhancement projects that were referenced in the budget, focusing on workforce employment, and access to care, totaling over $93.2 million in investments. HCBS settings final rule compliance. We're working to move closer to federal compliance on those settings. Autism and SED waiver renewals. We're currently up for additional renewals for IDD and PI, I believe. Waiver amendments. We're currently working through processes on these, but we've been able to do amendments that included paid family caregivers, telehealth options, and performance measures. Money Follows the Person grant is a federal grant that allows us to make sure that when we move people into communities from settings that they have dollars that follow them for services. And then planning and implementation for a new community support waiver. And right now we have that out to secure a task order for that. We are operating under a plan to implement a new Aging Services Commission. This commission will be formed from members of the previous LTSS commission. And we're adding a new commissioner to our ranks of leadership. This commission will directly provide services and supports for Kansas seniors, including community supports, and manage the nursing facility program. So this includes our Aging Services, Older Americans Act from the feds, our State Senior Care Act, our Senior Nutrition Program, and our PACE program. And then the nursing facility program includes regulations, gatekeeping, and quality programs. Priorities for the new Aging Commission. These include expansion of the PACE program. We're also collaborating with KDHE on the Building Our Largest Dementia Infrastructure, BOLD grant for Alzheimer's Act. We're educating mandated reporters and trying to increase awareness about prevention, fraud, and exploitation, as well as abuse and neglect. We've been working to enhance assistance to Medicare beneficiaries and healthcare providers regarding fraudulent Medicare activity. We're exploring ways to enhance support for our increasing demand for caregivers. And we're beginning work on drafting our next 4-year state plan on aging, which is a federal process that includes several regional listening sessions and a survey to gather additional public input. And then lastly, we want to work to make sure that we're raising the profile and public awareness of aging services in Kansas during the next few years. And I will pass to our next Deputy Secretary, Scott.
We pause and see if there are any questions at this point, Andy.
Certainly.
Representative Barth.
Thank you, Chairman Mason. Thanks, Andy. So the program, the Aging Services Commission, you said that's new. How did that come about? And my memory seems to not be remembering it. So can you tell me about that?
Yeah. So the secretary, when we first began the Kelly administration, we combined our Aging Services Commission with our HCBS services and made a long-term services commission, or LTSS. And that commission was set up similar to the structure that the federal government has around that. We found over the course of time that reduced the sort of the awareness of those aging services in the communities, and also maybe detracted a little bit from our ability to do strategic planning around those issues. So this new commissioner will come in and help support better promotion of those aging services, which is an important part of our agency's mission.
Will you use existing staff then, or in volunteers to make a kind of a commission board like the Commission on Disability Concerns, for example? And then is there a fiscal note I didn't see in the budget?
Yeah, so there's no official note for this. We're doing it with existing resources. But we do already have statutory requirements around aging, an aging council that's an advisory council here in Kansas. So they'll work with that, the commissioner will work with that group. Yep.
Committee, other questions? Representative Ballard.
Thank you. Andy, if we look at page 10, exploring ways to enhance support for the increasing demand for caregivers, that seems to be an increasingly difficult task for people to do now. Can you just explain that further,
I think you're right, that it is a very difficult task. We currently have a lot of issues around that, and one of the things I think that's important to realize is there's not a lot of respite care available for caregivers. And so we're looking at ways that we can find opportunities to support caregivers in the work that they're doing, but also allow them access to services that would support them in the role that they play with their families.
Is that going to require additional monies, or are you doing that within your means?
I think right now what we're trying to do is explore our options. So I don't know that right now we have a plan for whether it's going to require external funds or not.
That is one that you hear often about. You know, I think about like the wounded warriors. You know, part of that was for the military because they realized that the caregivers were not really getting any kind of break at all, and it was continuous. And so that's why there's a big effort on that one. So I'm really happy to see this one there because caregivers often work too, plus take care. And there's just a whole combination of things that they get burned out, and where do they go? Thank you so much for that. Thank you, Mr. Chair.
Any other questions? Just a quick one, Andy. Within that Behavioral Health Commission umbrella, was there anything in there addressing problem gambling, or is that just part of it?
So our problem gambling funds are part of the Behavioral Health Services Commission. And so we have right now both a team, right, of 4 individuals. That team was increased by 2 individuals last year in the budget. And so we're working right now to make sure that those teams are developing not only new materials, but we're also looking at how we can work with the lottery in order to make sure that our campaigns and their campaigns are working in conjunction with each other. But we do right now currently have the ability to support treatment services and also prevention services.
Are you far along enough to have data, statistics on how things are working?
Yeah, we have information about things like the number of calls we're receiving at the call centers, the number of people that are participating in treatment, those kinds of things.
That could be forwarded at some point. That would be wonderful.
Sure.
Committee, other questions? I'm seeing none at this point, so I think you're up, Scott.
Thank you, Mr. Chairman. My name's Scott Bruner. I'm the Deputy Secretary for Hospitals and Facilities within KDADS. Andy did a good job going through our programmatic, the side of our agency and the kinds of people that we serve. My role is working with the part of the agency that enforces regulations and does surveys and inspections, and then, of course, the state hospitals. We've talked about that before. So both of those are parts of the KDAD responsibility, is to make sure services are available to folks across the state, people with disabilities, physical disabilities, intellectual disabilities, seniors as well. And our responsibility is to make sure the places where they receive those services and the people who provide them are trained and qualified, and there's a way to report incidents that might happen. So my part starts with the survey certification and credentialing commission that I work with. That commission protects public health in Kansas through the inspection and licensing of adult care homes and providers of disability and behavioral health services. Primarily, that's with adult care homes, so nursing facilities. We have a team of nurse surveyors who go out into facilities, investigate complaints, do regular annual licensing surveys to look at the condition of facilities and the way they provide services. We also look at life safety issues. We work with enforcing regulations around adult care homes and provider of disability and behavioral health services. I've already said that, and we've got a field staff that perform those activities. Talked about nursing facilities. We also inspect disability providers, behavioral health providers, substance abuse providers, residential care facilities, facilities like that. Another part of this commission is running an abuse and neglect hotline. So we have an 800 number that's available statewide that individuals can call in and report if they have a loved one or themselves has been injured or harmed or abused, neglected, or exploited in their care setting, they can call in and report that. We triage every complaint. We investigate many of them to find out what happened and if there's some other enforcement action that has to take place. That's all within the Survey and Credentialing Commission. The last item that's on slide 11, in very rare cases, we can take facilities into receivership, which means if they're financially no longer able to operate and it's going to create a risk to the people that are living in that facility, the state can step in and take over operations of it. We'd done that in a kind of a large way over the last 4 or 5 years, and we're on our last facility that's just been sold that we had in receivership. So we're out of that business now, but it is still part of our statutory authority. The last item that I didn't put on the slide, but it's important to note, we also, the credentialing part of that commission is credentialing and providing licenses to different provider types. So there are 8 providers that KDADS either licenses or credentials. We operate for example, certified nurse aides are a designation of nurse assistant that work in nursing facilities. We oversee the program to see how CNAs are trained, how they're tested, and then issue certificates to them that show they've completed that training. We do the same thing for certified medication aides, for dietitians, and a few other categories as well. A couple of our priorities and accomplishments in the survey certification and credentialing. We always just call it SCC, so it's hard to get those kind of long words out. For that commission, we're working on finalizing the regulations for crisis intervention centers. We've talked about that with this committee in prior legislative sessions. We're very close to having those regulations complete. Once the regulations are done, then it'll be our job in the commission to figure out how to provide forms, applications for those centers to actually become licensed, and we've developed the process for that that's ready to go when the regulations are approved. I mentioned that we've already found work on completing the transfer for the final nursing facility that we had in receivership. There's a significant backlog of surveys that we need to complete. The other item that I'd just comment on is we have a pretty good vacancy rate among our nurse surveyors. So for nursing facilities, we do require our surveyors to be registered nurses, and those are hard to find. We don't pay quite as much as a registered nurse could make, either working in a clinical setting, and often we're sending people out all over the state to investigate and inspect different facilities. That's not for everybody, but we've worked really hard to make the pay more competitive, recruit more nurses into those roles. We've also started taking some using some federal flexibility to allow other kinds of license types to be surveyors. So we've hired a couple of licensed practical nurses. Their role is the same. They work in a little different way, but that's added some capacity as well that we continue to work on. As just make sure we can be timely investigating complaints that we get and also completing those regular licensing surveys. The other commission that I'm responsible for is the State Hospital Commission. So we formed a separate commission to work with the state hospitals a few years ago. We think our role is to help provide leadership and guidance and some direction to all 4 of the state hospitals. You've met Commissioner Dixon or Superintendent Dixon or Acting Superintendent Dixon. He has a lot of jobs, but his role is to really provide that oversight to all the superintendents and provide guidance on projects that serve all 4 of the campuses. Maintaining certification for the 4 campuses with CMS and Joint Commission accreditation is really important for how we operate, how we're funded, and that requires a lot of effort that we do try to coordinate from the commission level. We also work quite a bit on stakeholder relationships. And the campuses certainly do that too. That's the superintendent's role in Larned, Osawatomie, here in Topeka and in Parsons, to have connections to the communities where they work, where our employees live, where the folks that are either our patients or our residents, where they live as well. So they do a lot of different kinds of things, and we talked about that when you heard the state hospital budgets about the kind of outreach activities that happen, working a lot with local communities, and we try to support that from the commission as much as possible. The other primary role for our commission here in Topeka is to take some projects that are important for the hospitals to execute, but where the hospitals are busy doing patient care and resident care, and that's important. So we try to lift some of the administrative burden on contracts and projects. So we have an electronic health record project that's ongoing. We're leading that effort, but kind of doing more of the administrative activities to make sure that can all happen, and a few other projects along the way. And then capital improvements is the other item that as Dayton talked about. The capital improvements budget is in the KDAD's budget, and we distribute it out to the hospitals for different kinds of projects. In terms of our priorities and accomplishments for the state hospitals, I don't think I'm going to repeat too much of what we've talked about when you heard the hospitals' budgets, but just a couple of items. We're completing some pretty significant projects that have been on our capital improvements list for a while. The remodeling of the Biddle building will open up 12 new beds for acute inpatient stays. That's an important, it's taken us a while to get there, but that's an important part of our capacity plan at Osawatomie and across the system. We also completed the raising of 2 buildings on the Osawatomie campus, which took us a while to find a vendor or contractor that would do the raising and then help us dispose of the material that was left behind. We learned a lot in that project, and I think with the governor's enhancement in their recommendation to give us the funding that we asked for all the raising projects that we have across all 4 campuses. Well, but there are all 4 campuses. We've learned some good lessons from that project. I think that'll help that money be well spent going forward. Recruitment and retention, we've talked quite a bit about with state hospitals. I won't repeat too much of that other than to thank you again for the support that you've all shown in the direct, the wages that we pay to direct care staff, nursing, our safety and security officers, really the people who are doing the important work. I think Superintendent Dinkle mentioned, and we noted here on the slide, the Larned Cares website is new for Larned Cares, that initiative for the community promoting Larned and employment in Larned. That isn't new, but we have rolled out a new website that lets you apply for a job at Larned State Hospital directly through the website. Just heard today a report from the campus of they've already, in the first month it's been available, they've already had 6 people apply through that path. And a couple of them, I think, made it through the hiring process to actually start. So we're seeing some good traction from that. On slide 15, just a couple of other items. We have been working on community-based competency evaluation and restoration. When we talked to you about the Larned Hospital budget and the wait time to get in for a competency evaluation, one of our initiatives around addressing that wait time is to use local providers as much as we can to complete those evaluations while defendants are still in jail. We've contracted through Wheat State Healthcare with mental health centers to be trained on performing those evaluations and doing the restoration to competency efforts. You've appropriated $2.8 million for us to pay mental health centers to do those evaluations and restoration, and that's been a little slow in starting, but it has. But we have been paying mental health centers for those evaluations. We've seen the number increase over the last couple of months, and we're hoping that continues to build in partnership, because it does require a lot of connections between the mental health center as the evaluation competency evaluation provider, the courts to modify their orders or write their court orders so that the mental health centers can do the evaluation, and they're working with prosecutors and defense counsel as well. So lots of activity around that. Then the last item is the state institutional alternatives. So our other kind of capacity initiative is to not just rely on state hospitals, but rely on community hospitals that can serve patients that need that acute level of care that someone would get at a state hospital, but they can do that closer to their home. We've got eight hospitals that we partner with as SIAs. And that program is working well. It's efficient for us as a state and as the agency that works with those patients. This process is seamless in terms of intake and how people are screened. So we're going to add another hospital to that list in April. I think they're going to start admissions at Hutchinson Regional. But we manage part of that program from the commission side. Just because the money's in the KDAD's budget. And then just the last comment I would have, I didn't put it on the slide again because we've talked about it before, but the other significant project that we've got at the commission level is getting the building done or building the new regional state psychiatric hospital in Sedgwick County. That's one that I'm involved with. It's kind of my primary activity over the next couple of years is to get that project underway. But with your financial support for that and the direction, we're making good progress in terms of a site and design and working. We've got an advisory panel that the governor's appointed as well that Representatives Carpenter and Hobson are on. We're getting a lot of input, thinking really hard about the project, how it fits. Very excited to see that come to fruition and tell you more about it as we get further down the road with that project. But those are my two commissions, so I'm happy to answer questions.
Committee questions for Scott. Representative Carpenter.
So Scott, how much is in the receivership fund now, do you know?
Not off the top of my head, but we can get that
Pulled
for
that
you.
number for a while.
Okay.
And you might explain how that fund is built.
So we use money from what are civil monetary penalties. So if we assess a fine on a nursing facility, that money goes into a fund. And then for receiverships, what CMS allows us to do is use some of that funding to pay costs related to a building that we're effectively operating. It's also transactional because those facilities are still billing Medicare and Medicaid where they can, so there's revenue coming in, but there are some expenses that come through the Civil Monetary Penalties Fund for that purpose.
Good. Thank you for that.
I'm being told 6.8 million is in that fund.
6.8?
Yes.
Any other questions? I'm seeing none.
Great. Thank you.
Thank you, Mr. Chairman. Secretary Howard, back at the mic. Thank you. Page 23 is just a brief chart that shows some of the status of some of the COVID funding that we received as an agency. You can see that we're still spending some of that funding in this current year through our grantees. These are, if you glance down the list, you'll see these are primarily funds that came through us through the Federal Administration on Aging and the Federal Substance Abuse and Mental Health Services Administration relating to aging services or mental health services. And so some of that funding is still being paid out during this current year or being spent out by our grantees during this current year. I'm now going to skip you actually to page 23. We have the same kind of charts in here for fiscal year 24 and fiscal year 25, and they're very similar. So instead of walking through those twice, I'll just kind of walk through those once, especially given the pie charts that Dayton talked about. I think these are very complementary, maybe laid out in a different way, but our budget didn't change very much from year to year. But on page 23, just again, that overall picture of the KDAD's budget in terms of in fiscal year 25, a total budget of just under $3.1 billion. And you can see from the pie chart and the details there that about 56% of our budget from federal funds, about 42% from state funds, a little bit from some various fee funds like the funding that comes in for problem gambling, and then the capital improvement funds. Those are, small amounts of the total, but about 56% federal funds. And if you look by program on the very next page, the vast majority of our expenditures are through those Medicaid-related activities, the nursing facility program, the home and community-based services, the Medicaid side of behavioral health. So you can see about 88% is related to Medicaid-related expenditures. And then as you look down, you'll see beyond that, the next highest would be the remaining funding within our behavioral health program, about 6.5% in behavioral health. I mean, that includes some state grant dollars, that includes of federal block grant dollars from our federal partners. Then you can see smaller amounts in the remaining areas. I really wanted to just give you a context for how much of a Medicaid agency we are when you come right down to it. We just are a very large Medicaid agency. And the next page, page 25, really details that as well. You can see that as well when you look at the SGF by program. 81% of our SGF-related dollars also relate to those matching federal funds for Medicaid-related services. So again, that really puts that into context. We obviously have some other state funds. 10% of our state funds are other programs within behavioral health. But again, those dollars get smaller as you go down that table. So again, just that context. On page 26, maybe the last point on the Medicaid funds, you can see that of all the federal funding that we get as an agency, 96% of the federal funding we receive as an agency is Medicaid dollars. The next highest tranche is about $13.6 million that we get from Older Americans Act funds that goes to the various community-based aging programs. You'd be most familiar with nutrition, but there's some other facets of that funding as well. And then the next highest one after that, also at about $13 million, is the block grant that we get from the Federal Substance Abuse Mental Health Services Administration related to both substance abuse and that's actually the substance abuse block grant that goes for treatment services for individuals who aren't Medicaid eligible. So you can see the other lists as you go down, but again, just to give you that Medicaid context. In terms of expenditures by category on page 27, I think this is similar to what Dayton shared with you. If you look at our overall budget, $2.9 billion of that going out in aid and assistance. And again, I already talked about the vast majority of that being Medicaid. So again, just gives you a context in terms of how much of our budget actually goes to direct services to individuals. Page 28, kind of how our positions play out. We have the largest number of allocated positions in our agency in our Survey and Certification Commission. These are those surveyors who are out on the road every day doing those surveys and investigations of the various adult care homes and other facilities that we have responsibility for, as well as the credentialing staff. You then see some of the administrative pieces, all of the, we have all of the financing, procurement, and those pieces, and then the breakout for the rest of the commissions for total positions of 367. The next section, Mr. Chairman, begins to go into the budget pieces. I know you've already heard this once from me, and you've heard it again from Dayton today, so I will be brief and just mainly give you time for questions. But again, in 24, apart from caseloads, the governor did fund the shortfall in the pay plan, as she did for all of the agencies. And then in fiscal year 25, we would certainly ask your support for the 11 enhancements and the GBA that the governor recommended. And again, I won't go through those in great detail, but the table on page 31 and 32 gives you a brief summary of those enhancements, and then the pages that follow give you a little bit more detail. Again, I talked about these last week, and Dayton talked about those. But within behavioral health services on page 33, the first recommendation from the governor was for an employment and benefits coordinator, really allowing us to give priority to employment first for individuals with behavioral health issues, the option to find work and be ingrained in community life. This would really focus a lot on individuals exiting institutions, whether those are NFMHs or state hospitals. And as Dayton indicated, the governor provided the funding and asked us to find the FTE within our current FTE, which we're able to do. The next BHS item on page 34 was the family support coordinator. Again, really to fund some of the various family and child-based programs that come to us from SAMHSA and from HRSA, the federal HRSA agency as well. And again, the governor again provided the funding for the position, but again asked us to find the FTE internally. So we're very pleased to see those two. The third item in behavioral health services, as I mentioned the other day, this was a real priority of Chief Justice Lukert. She brought together a committee to look at the creation of family treatment courts. The court system has had so much success with some of the specialty courts, veterans courts, some of the substance use courts. And she heard of some states that were doing some things in the child welfare arena around parents with substance use issues. And so there's been a work group that's been working on that I have team members from both KDADS and DCF serving on. And so what the governor has done is recommending $1.5 million for the treatment costs as those family treatment courts would kick off. 3 jurisdictions, Cowley, Lyon, and Miami counties are slated to implement those family treatment courts beginning in September. So we're excited about that. And then the fourth item within behavioral health services, we talked about this quite a bit last time as well, is the one-time $40 million funding that the governor has allocated in response to requests from about 15 different communities and a number of organizations related to local homelessness infrastructure to be provided on a one-time basis, targeted to homelessness infrastructure and requirements for matching funds with ongoing operational costs paid locally or through those organizations. And then the last item in behavioral health services was a position to serve as a housing supports director to allow us to work more closely with the governmental agencies at both the state and local levels, as well as nonprofit organizations around issues relating to housing challenges. We certainly know that, we do some work already in housing around supported housing, and this position would help us to really enhance some of that work. The next set of items, Mr. Chairman, relate to our HCBS programs. The first also had to do with positions for related to the community support waiver, an IDD assistant director, a community support waiver program manager, and the ability to keep on 2 quality assurance positions that we use some federal funds to start out to kind of save state dollars at the front end. So again, I think these are really important as we're focusing on the development of that community support waiver and to put us in good stead as we kick that off. So again, we were excited to see that recommendation. The second one in the HCBS area had to do with the rates paid for supported employment. And also the unbundling of that supported employment rate in the IDD waiver, which we've been directed to do by the federal government. The governor's recommendation would increase the rate from just under $18 an hour to $28 an hour to further incentivize employment services. So as Dayton said, that was part of what we requested. So it was a step up for that rate. The governor also recommended in the HCBS programs a separate program manager for the technology-assisted waiver. I think as I talked to you last time, that's the waiver that serves youth who have very, very extensive needs for both for very extensive nursing in the community as well as reliance on a lot of medical equipment, oxygen and other things to sustain their life. And this is a waiver that, if not for this waiver, those children would actually be growing up living in a hospital. This program now has 800 youth on it. It's very extensive, and we have one person who's trying to manage both this program and the SED waiver. So the governor can give us funding to have a targeted person specialized on that. The last HCBS thing is the governor's budget amendment that Dayton already talked about to add 250 slots to both the IDD and the PD waiver. I have some data on the number of individuals we were able to place in the last calendar year on page 41 for both the PD and the IDD waiver and what the current waiting lists are. So again, about $6.6 million general fund for the IDD waiver and 2.2 for the PD waiver. waiver to really make some investment there while we're developing the community support waiver. The last couple pieces then relate to capital improvements. On page 42, the governor recommended $5.6 million from SIBF to fund our kind of second tranche of rehab and repair projects. That will touch all 4 of our campuses, but the most significant part of that enhancement is actually at Osawatomie, and it will be the start of a major project that has to do with replacing their medium voltage electrical system. Overall, that project will cost $6 million over 2 to 3 years. So this will begin that project. And then as Deputy Secretary Bruner alluded to earlier, the governor's also recommended funding from the State Institutions Building Fund of $3.2 million, which would allow raising of all 9 remaining buildings that are on our list to be demolished. And again, as Deputy Secretary Bruner alluded to, when we were doing bidding and things on the raising projects like at Osawatomie, we definitely had some struggles in terms of being able to get bids within costs, and the ability to combine some of these projects can probably help us then to get some cost savings and some viable bids to continue to do that. The last item related to the State Hospital Commission is a shoe and boot allowance. This kind of came through some dialogues with KOS, and the governor's recommended funding, like what happens with the Department of Corrections, to fund shoe allowances for safety and security officers and nursing staff. We also, of course, would ask for your support for the state employee pay when the full appropriations committee looks at that. The remaining pages, Mr. Chairman, they're just some basic data that just gives you basic caseload information across our various programs. I'm happy to let you look at that at your leisure, happy to answer any questions about those and some metrics as well, but I'll stop there for any questions.
Very well, very well. Representative Hobson.
Thank you, Mr. Chairman. Thank you, Madam Secretary, for your presentation. If I can take you back to slide 35, page 35, with respect to the 3 jurisdictions there, Cali, Lyon, and Miami counties. Was there any specific reason why these 3 counties, or is there any specific reason why it was these 3 counties for the family treatment court?
In terms of the treatment courts, let me ask my deputy secretary if he knows. I know that happened through the court process, but do you know if there was a criteria?
Eventually, will this actually move statewide? That's what I'm trying to understand.
So this is for the family treatment courts?
Family treatment courts.
Yeah, so I don't know that there's a specific criteria. I think that we've got a lot of work with DCF on this, and I think they kind of have more information about the individual courts themselves and how those are being set up. But there are sort of federal level criteria that impact us that are related to the number of days, I think, that people have to follow up. So so it's something I think might be a better question for DCF.
I think too, Representative, that when the Chief Justice and Justice Stanridge from the Supreme Court were looking at this too, I think they also talked with, fellow judges across the state, also just to see where there might be interest in starting this as a pilot, because obviously the goal is to see how the pilot goes, and then look at, some metrics from that and look then at expansion statewide. That's also why the governor only recommended half the funding we requested, because based on the timing of this and the number of jurisdictions, the $1.5 million should be sufficient. So
in essence, eventually this will actually go statewide. This is kind of like a pilot.
We certainly hope so. Should it be a successful program? Certainly the Chief Justice is articulating it as a pilot, and we have every anticipation based on the success of other treatment courts and the success of this model in other states that it will be. But it's going to, I think, be important for us to be able to bring metrics back to you that show things like reduced length of stay in foster care and things like that.
If I can take you to page 42. Where it has the $2.3 million for enhancement with major maintenance project. Are we going to be using Or is there any plans for the facilities to actually move to more energy efficient, you know, conductors, energy and all of that, since we're spending like throughout all campuses, moving towards solar, trying to save money in the long run for,
Sure.
is that the initial plan or
Yeah,
is there?
thank you. I mean, there've been a number of sort of energy efficiency projects done at the state hospitals over the years, and some spending from the SIBF over in different tranches of time to look at sort of those kinds of energy efficient processes. So I'll ask Deputy Secretary Bruner if there's anything more specific we'd want to say about that.
Just at Osawatomie in particular, one of the things that we changed was our electrical services moved from being supplied by Evergy to the city of Osawatomie. So that isn't related. We still need to update the distribution system, but in making that transition, there's part of our property that is state-owned that we've given to the city of Osawatomie to develop, and they are developing a solar energy installation just north of our campus. So part of the distribution plan is they're supplying our energy. We can use that solar farm, but that's the biggest one that we've done in terms of energy efficiency projects. Like the Secretary said, we've done lots of things with windows and more efficient chillers and things like that. But so a lot of the infrastructure that we have is large boilers, high pressure steam, and there's only without converting a lot, that those are harder things to find efficiency over time.
Okay, I was just, oh, if I can, just basically, if they were purchasing most of these equipments, any equipments that actually use less energy, I guess that's what I'm trying to say. In some of these facilities, that would be helpful in the long run.
Sure. Yeah.
So, okay, thank you.
Committee, other questions? I have a couple quick ones. You referenced on one of your slides, and I haven't been able to go back and find it, but 367 positions. Do you have some vacancies in that? What would you say your vacancy rate is?
We do. Let me see. Gosh, I know I had that the other day. Because I remembered Representative Carpenter always asking that, and I know I had that written down the other day. If not, I may have to look to my budget team. Do we know how many vacancies we have? Yeah. If not, we can bring that back to you tomorrow.
Other question I would have, with respect to the governor's budget amendment number 1, were you involved in the thought process on that? I know originally KDADS had asked for 500 slots for each of those waivers. The governor's budget did not allow it, and then it came back at 250 and 250. But just looking at the waiting list, like there are currently 1,000. No, I'm sorry. On the PD and 5,100. Would it have made more sense to do proportionate, like 10%, or which would be 250 and 500, or?
Yeah, I think that's, sure. I mean, I think that's really a policy decision, Representative Mason. I think, the governor in doing the budget amendment really just kind of took our request and cut that in half. I mean, certainly, as you can see from what we put on the slide, we have more movement on the PD waiver every year. More people come and go off of that. So we have more people come on to that, even without new money, than we do on the IDD waiver. You're certainly correct about that. Yeah.
Very well. Committee, last call for questions. Representative Ballard? We're thinking.
I'll let Deputy Secretary Bruner answer the details. Yeah.
It's $250, that's correct, and we believe it's going to be an annual an annual amount, distribution, annual amount per employee, yes.
That's a tough question for me, Representative Ballard. I appreciate the budget that the governor recommended for us, and I support that budget, so, yeah. 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 I imagine you'll hear, sure, sure, sure. You did, thank you. I do, and obviously you'll hear other views tomorrow, so in terms of, yeah.
Madam Secretary,
Yes.
from the committee, thank you for
Sure.
you and your staff being here. One last thing before we adjourn for the day. Dayton has some information on a question that was asked earlier, and I will have him present that. Dayton? Okay.
Thank you, Mr. Chair, members of the committee. During my presentation, Representative Clifford asked about payments to counties for the SB 228, which is the reimbursement to jails. I've handed out a document with the counties that have received payments in alphabetical order. The first column are payments for 23. So retroactive payments were allowed. So even though the payments were made during 24, they were allowable for 23, as well as fiscal year 24. You have a county total in the rightmost column, and then annual and program totals at the bottom. Those are, accurate through February 7th of this year. I would also note that the KDAD's budget also has reimbursement for hospital observation. There's also $5 million for that. And the total payments for that so far for the first 6 months of the year were $185,000. And then one final note, the Joint Committee on State Building Construction did review the capital improvements and recommend them. Forgot to note that during the presentation. And I now stand for questions.
Committee, questions for Dayton?
Refreshing my memory again
Ballard.
about what these payments were for.
These are payments to counties for observation, for holding individuals who are waiting transport to maybe Larned for competency evaluation and restoration. It's pursuant to Senate Bill 228. The other thing I would note is you'll see the total is 6.3 million. The budget has 5 million. This is a demand transfer from the state general fund, so it can exceed that 5 million. That's really an estimate. And I'll provide more detail in next year's budget analysis.
Committee, other questions?
Thank you, Mr. Chair.
Representative Barth.
Thank you, thank you, Chairman Mason. I do have a question because I know this was the topic last year. Miami County got 53,000. I feel like the number was much larger than that they were owed in some back pay for holding folks, maybe in the hundreds of thousands of dollars. Does that ring a bell?
Mr. Chair, Representative, it does not ring a bell to me. I don't recall. I know there are some requirements, I believe, in how the payments are made, and I know Scott probably wants to jump up here and answer that if the chair would allow.
Since you asked it, open the can of worms here. Thank you.
Is that true, Scott?
Didn't look like
I don't know about jump, but Scott Bruner, Deputy Secretary. So Representative Barth, the county had provided the agency, provided KDADS an estimate of what they had spent on holding people waiting for competency, the issue that we're talking about. And I can't remember what the exact amount was in that request letter. 450,000 is what's kind of coming to mind. The time frame was not the same as what Senate Bill 228 authorized us to do. So they were counting some defendants that they had been holding for a number of months or a year prior to the time frame that's identified in Senate Bill 228. So what's on the list that Dayton provided is in Senate Bill 228, we were authorized to go back to July 1, 2022 through current day. So, and it's authorized at $100 a day for every day that somebody's waiting after they've been ordered to Larned or Osawatomie or one of our facilities until they're admitted. So that amount reflects defendants they had in their jail in that time frame for that number of days.
Thanks for the clarification on the dates then. Have you heard from Miami County, whether it be the commissioners or the folks at the jail there, on any, like, numbers that have they reached out to you at all, I guess, about the numbers?
Other than they're sending us requests, so we created a form, and I did some trainings last summer on how to submit the requests. So they gave us the list of defendants that they had that were in their jail in those timeframes and how many days they had reported in that same time frame. We did some verification, multiplied that number by 100 and wrote checks. So we've had that communication with Miami County. I don't recall anything since we got the letter from the county, and I went and talked to some county commissioners with the superintendent two Decembers ago. I'm losing track of the time, but not more about that earlier request that the county had made.
I know this happened last summer, so as far as you know, since last summer and you haven't heard anything else or any other concerns?
Not other than requesting funds for people that they have waiting in the Miami County Jail. We still have an ongoing discussion with Miami County, the county attorney and the sheriff, because the counties where our state hospitals are located have some unique situations that don't happen other places. So we do try to work with the county and the sheriff to talk about when we have a patient on campus that assaults a staff member, what happens then, and people going to jail. That's not exactly the reimbursement, but so we're in conversation with law enforcement, the jail district attorney, about the impact we have on the judicial process in the counties where our hospitals are.
I appreciate that, and this affects our committee, but specifically, I have that in my district as well.
Of course.
So it is of high interest there, so
Yes.
I'll be sure to just check up with them too. Thank you.
Sure, and if there's something that they need, they're more than happy to have conversations with them. But we do, I think it's monthly, might be quarterly. We meet with, the superintendent meets with the county attorney and the sheriff and Osawatomie PD and others, just to kind of say, here's what kinds of things are going on that we could do better or how we could work together.
Committee, last call. Okay, we will continue this budget hearing tomorrow. We'll have public input, so buckle up, and we're adjourned.